Hi, my name is Lisa Smith. I'm a student at Maryville University. Today I will be performing a head-to-toe assessment on my patient Timothy. Prior to me entering the room, I had Timothy get changed into a gown and empty his bladder. Basic measurements were already taken, such as vital signs, height and weight, near vision testing with the Rosenbaum chart, and far vision testing with the Snellen chart. First, I will be assessing Tim's head. Tim's head is upright and still, negative for any tics. The skin is clear and intact. The external characteristics, the eyes and the ears, are symmetrical. There are no obvious masses or deformities. The skull is smooth upon palpation. There's no depressions, masses, or nodules. The hair is brown in color. It's evenly distributed over the entire head. There's no alopecia present. The hair is firm in the follicles. It does not easily come out. I will palpate the facial bones. Good. And the facial sinuses. The frontal and the maxillary coming down from the zygomatic process. And open your mouth for me, move your chin side to side. The temporomandibular joint is negative for any popping or clicking, and also negative for any pain. Next, I will palpate the skull. It is freely mobile. There's no nits or scaling present. Next, I'm going to assess Tim's cranial nerve 7, his facial nerve. Can you close your eyes real tight? Good, wrinkle your forehead. Good, you can open your eyes. Puff out your lips. Good, puff out your lips. Purse your lips and blow. Good, show me your teeth. And smile. Very good. Tim's motor cranial nerve 7 is intact. At this time, I would also test salty and sweet for the sensory portion of cranial nerve 7. I would also test the sensory portion of cranial nerve 9, which would be sour and bitter at this time. Next, I'm going to assess Tim's trigeminal nerve, cranial nerve 5. I'm going to assess for light sensation. Close your eyes and tell me if you feel this equally on both sides.
Yes.
Good. All right, and clench your teeth for me. Good, and he has good muscular tone. You can open your eyes. He has good muscular tone, so trigeminal nerve 5, motor and sensory is intact. Next, I'm going to be assessing Tim's eyes. His eyebrows are symmetric, equal bilaterally. The hair is evenly distributed. There's no orbital or periorbital edema noted. The eyelids cover the irises partially bilaterally. There's no ptosis present. Close your eyes for me. There's no nodules or tenderness. Going to palpate the lacrimal apparatus. Good, and there's no excessive tearing or exudate. And Tim, can you look up for me? Good, the conjunctiva are pink and the sclera are white. You can come on back and look down. Good, the eyelashes curve away from the globe. There's no excessive drainage or exudate noted. And next I'm going to test Tim's peripheral vision. Tell me when you see my fingers.
Yep. Yep. Yes.
Okay, I'm going to test for direct and consensual pupillary responses. Look right at my face. Good. Good. And the pupils constrict appropriately. Next, I'm going to test for accommodation. Look over my shoulder at the wall behind me and look right at the tip of my pen. Good. The pupils constrict appropriately for that as well. Next, I'm going to test any extraocular eye movement. Follow my pen with just the tip of just your eyes and not your head. Good. There's no extraocular eye movement noted. Good. Next, I'm going to assess for the red reflex with my ophthalmoscope. Okay. And the red reflex is present in both eyes. By performing these tests, cranial nerves 3, 4, and 6 are intact. Next, I'm going to move on to Tim's ears. Going to just inspect the outside. They are normal skin tone and color. They are aligned symmetrically on either side of Tim's head. They are, there's no excessive drainage noted on the outside of the ear. The auricles are firm. There's no nodules, no masses or tenderness. Next, I'm going to look at the inner ear canal. It is free of any cerumen. The tympanic membrane is pearly gray. The cone of light is present. There are no perforations noted. Going to take a peek at the other side. The tympanic membrane is pearly gray. Cone of light is present. No perforations noted. The inner ear canal is free of any cerumen and no redness. Tim, can you please cover your left ear and close your eyes? Repeat after me.
Green.
Good. And close your right ear Close your eyes. Repeat after me.
Blue.
Good. So whisper test. Tim is able to hear on both the whisper tests. Next, we will do the Weber and the Renee test. Weber will test for unilateral hearing loss. Tell me when do you hear this equally in both ears? Good. And for the Renee test, tell me when you stop hearing this.
Okay.
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 Okay, good. And air conduction is greater than bone conduction. I would do this on the other side if time allowed. Next, I'm going to inspect Tim's nose. His nose is aligned midline. It is equal skin tone and color as the rest of his face. The nares are oval, and there are no signs of flaring. Can you cover your right nostril and breathe in and out? Good. And your left, and breathe in and out. Good. Both nares are patent. Next, I'm going to take a peek up the nose. The turbinates, medial inferior, are the same skin color as the surrounding tissue. The nasal mucosa is a deep pink and glistening. The septum is midline with no perforations, no deviations, or no bleeding. Tim's cranial nerve 1 sense of smell is intact. If not, I would have different scents for him to test. Next, I'm going to look at Tim's mouth. His lips are pink in color. They're negative for any cracking. And can you go ahead and open up your mouth for me? Good. The buccal mucosa is pink, smooth, without any lesions. And lift your tongue up. Good. The floor of the mouth, and move your tongue side to side. The floor of the mouth and the sides of the mouth are negative for any lesions. This is where I would screen for oral cancer. And there are 32 pearly white teeth. The gums are tight at the teeth. There is no bleeding noted at the gums. Go ahead and stick your tongue out for me. Good. The tongue is moderately rough. It is moist and it is dull red in color. There is no mouth odor present. And go ahead and stick your tongue out. And the uvula is midline. Tim's tonsils have been removed. Actually, lift your tongue up for me. The ventral surface is smooth. It is a deep pink and it is glistening. All right, Tim's tonsils have been removed, so I cannot assess those. All right, stick your tongue out and say ah. Okay, the anterior and the posterior pillars are both intact. No signs of redness or exudate or infection. The posterior pharynx is smooth and glistening. And can you tilt your head back for me? Good. The soft palate and hard palate are intact, and soft palate is continuous with the hard palate. Next, I'm going to assess cranial. There is no mouth odor noted. Next, I'm going to assess cranial nerve 10, which simultaneously stimulates cranial nerve 9. Stick your tongue out and say ah. Good. Uvula remains midline, and you can put your tongue back in. All right. And gag reflex is present. And can you take a sip of water for me, please? Good. And no difficulty there. Next, I'm going to assess cranial nerve 12, the hypoglossal. Can you push your tongue against your cheek? Good. Good. And try and touch your tongue to your nose and your chin. Good. And stick your tongue out. And midline with no tremors noted. Next, I'm going to have Tim go ahead and remove your shirt for me. Good. Going to inspect Tim's neck. I do want to note he does have a band-aid here. He had a mole removed. I already looked at the sutures. They were clean and intact. No signs of infection. The skin of the neck has equal muscularity, symmetric on both sides. There's no obvious JVD or carotid pulsations present. The thyroid is not visible. Next, I am going to palpate the carotid pulses one at a time. Good. And the carotid pulses are strong and equal. Next, I'm going to palpate the trachea. It is midline. Okay. And negative for any tugging. And here's your cup of water again. And going to palpate the thyroid. Can you go ahead and take a sip? Good. All right, and one more. Good. And the thyroid is smooth, no nodules noted. Thank you. Next, I'm going to assess Tim's, I'm going to palpate Tim's lymph nodes. Can you lean your head back just a little for occipital? Good, and look straight ahead. Good, postauricular, preauricular, tonsillar, submandibular, segmental, anterior superficial cervical chain, posterior cervical chain, and lean your head this way, deep cervical, and this way, deep cervical. Good. And the lymph nodes, I use the pads of my fingers in a circular motion. Next, I am going to auscultate Tim's carotid arteries. Take a deep breath in and hold it. Okay, both the thyroid and the carotid arteries are negative for any buoys. Next, I'm going to move on to Tim's upper extremities, his shoulders and his arms. His shoulders are symmetric and equal bilaterally. There is equal musculature on both arms, equal hair distribution. The skin tone is appropriate for his age and race. Looking at the hands, the nail beds are firm. The nail plates are smooth and hard. Cap refill is less than 3 seconds. There is no clubbing present. The radial pulse is good. And the brachial pulse, again, strong and equal, 3+. Next, I'm going to go back and get his supraclavicular lymph nodes, infraclavicular lymph nodes, and lift your arms up for me, and axillary lymph nodes. Good. Normally I would do those with the chest, but I wanted to include it with the lymph node inspection. Go ahead and turn for me. We're going to start on the back. Tim's back is symmetrical. The skin color is normal tone. The skin is clear and intact. They're negative for any skeletal deformities. Next, I'm going to palpate. The AP diameter is less than the lateral diameter. And next, I'm going to palpate. There's no masses or skeletal deformities. Note it. The cervical spine is convex, and the thoracic spine is concave. Next, I'm going to palpate over the costovertebral angle. Good. And for cuss, any pain or tenderness. Good. Next, I'm going to do a respiratory assessment starting on the posterior side. And his respirations are even and non-labored on his chest. Both his chest and his back. The rate is normal. There is a symmetric rise and fall with each respiration. Okay, take a deep breath in and exhale out for me. Good. Thoracic expansion is appropriate and symmetrical. And say 99.
99, 99, 99, 99.
Good. Negative for any tactile fremitus. Next, I'm going to percuss his posterior lung fields. Can you lean forward and hold your elbows? Good. I'm going to percuss 10 times total down either side of the spine and the posterior lung fields and arms above your head, listening for resonance. I will do the side-to-side method so that I can compare the sounds on both sides. Good. And lean forward and hold your elbows again. Going to percuss for diaphragmatic excursion. Take a deep breath in and hold it. Good. And going to mark that here. And exhale all the air out. Good. And measure it here. Tim's is 5 centimeters. Normal is anywhere from 3 to 5 centimeters. For sake of time, we are just going to do the left side today. Next, I'm going to auscultate all of Tim's posterior lung fields. Okay, and take some breaths for me. Okay, and arms up. Again, I'm comparing side to side. Okay, good. And go ahead and relax on down. Okay, and go ahead and turn to the front. Tim's anterior thorax is symmetrical. There's no skeletal deformities. First, we will focus on the lungs. The respirations are equal, even, and non-labored. His respiratory effort is equal. There's rise and fall with each respiration. Go ahead and going to palpate the anterior chest, negative for any deformities. Good. And take a deep breath in and exhale out. Good. And thoracic expansion is equal on both sides. Repeat 99.
99, 99, 99, 99.
And no tactile fremitus is felt. Next, I'm going to percuss the anterior lung fields. And resonance is heard. Again, resonance was heard on the back as well. Next, I'm going to auscultate the anterior lung fields. Good. Okay, and next we'll move on to a cardiac focus. There are, upon inspection, there's no pulsations or heaving noted. Go ahead and lean on back for me. I'm going to palpate the anterior chest wall. There's no deformities and it is symmetrical. Going to palpate the precordium, start at the right sternal base. Go to the apex, left sternal border, and the base of the heart, Good. Negative for any pulsations, thrills, or heaves. Next, I will palpate the apical pulse. Negative for any heaves, thrills. Okay. Next, I'm going to percuss over the cardiac border. Good. All right. Next, I'm going to auscultate Tim's heart sounds. Go ahead and sit up for me, please. All right. Normally, I would do this in 3 different patient positions, but due to time restraints today, I'm only going to do this in one position. I would do the diaphragm first and then the bell. First, I start at the aortic. Good. And pulmonic, just breathe normal. Erb's point. Tricuspid. And mitral. Good. And I'll use the bell, starting at the aortic. Pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are normal and there were no murmurs heard. Next, I'm going to inspect Tim's abdomen. Go ahead and lie on back for me. Oh, my light's over here. Okay, looking at the contour of the abdomen, it is smooth and symmetric on both sides. The skin is uniform in color. There's no pulsations, there's no bulging, there's no distension, there's no visual peristalsis. The umbilicus is midline and it is inverted, which is a normal finding. Next, I'm going to auscultate Tim's abdomen. Okay, I'm listening for clicks and gurgles in all 4 quadrants, and bowel sounds are normal, active in all 4 quadrants. Next, I will use the bell of my stethoscope to auscultate for any bruits in the arteries, starting at the aortic, renal, iliac, and the femoral. Good, and no bruits were heard upon auscultation. Next, I'm going to start with percussion. I'm going to percuss over all 4 quadrants of Tim's abdominal cavity. And tympany is heard and dullness over the organs. Next, I'm going to percuss his liver borders, starting at the midclavicular line. Percuss up at the area of tympany. Good, and mark that. And again, starting at the midclavicular line, percussing down until I hear dullness upon the upper border of the liver. Good. And Tim's measures right at 9 centimeters. Normal is anywhere from 6 to 12 centimeters. Next, I'm going to percuss over the splenic area on the left side. And any pain or tenderness there? No. And dullness, I'm sorry, that was on palpation. Dullness is heard over the splenic area. Next, I'm going to palpate Tim's abdomen. We'll start with light palpation in all 4 quadrants. Looking for any muscle rigidity, also getting the patient used to the touch of my hand. Okay, and deep palpation in all 4 quadrants. Good. Next, I will palpate the right costal margin. Take a deep breath in. Good. And the liver, the organ is displaced downwards, and we will go to the left costal margin. And the spleen is not palpable, which is a normal finding. Next, I will palpate for the kidneys. Take a breath in and out. Good. And we'll go over on the other side. Take a breath in and out. Good. And I was able to capture the right but not the left, which again is a normal finding. Next, I will palpate slightly left to midline for an aortic pulse. Okay, very good. And next, I will palpate everything. Okay, all right. The abdomen inspection is complete. You can go ahead and sit up for me, please. Next, I will take a peek at Tim's lower extremities. Move this down here a little bit so you can see. The lower extremities are equal in length and size, equal hair distribution. The skin color is normal for age and race. There are no obvious lesions. There's no edema noted. I will palpate the popliteal pulse. Good. And the posterior tibial, which is on the back of the ankle here, sorry you can't see, and the dorsalis pedis, all are strong and equal. Next, I am going to look at Tim's toes and his nails. The nail beds are firm. There is no, the plates are hard and strong. The nails are clean, clear, and pink. There's no clubbing noted, and the calf refill is less than 3 seconds. I do want to add that on the hands, I would check the same thing as well. Not sure if I did that earlier, just wanted to note. There's no, the calf refill is present. There's no clubbing noted. The nail base is firm. The nail plates are smooth and hard, and there is no clubbing noted. Going back to the lower extremities. Next, I will assess Tim's deep tendon reflexes. Let's move this up a little bit so you can see. Okay, we will start with the brachial radial. Okay, just hold his arm at a 45-degree angle and relax your arm here. Good. And 45-degree angle and relax your arm here. Good. And we will do the popliteal. Good. And the patellar and the Achilles tendon. Good. Good. And he has good reflexes throughout. Go ahead and stand up for me. We will do musculoskeletal next. We already assessed the cervical range of motion. We're going to do cervical range of motion, active and passive. So usually this can be done with the assessment of the head, or it can be done in musculoskeletal. Chin to your chest. Good. And head back. Good. And look side to side. Good. And lean your ear to your shoulder. Good. And he has good passive range of motion and good cervical range of motion. This also knows that spinal cranial nerve 11, the spinal accessory, is intact. Okay, and shrug your shoulders for me against resistance and turn your head side to side. Good. And lean forward and lean back. Good. And good active range of motion as well. And go ahead and turn around for me, please. Okay. And there's no obvious skeletal deformities. And can you lean forward and touch your toes? Okay, and I'm feeling each vertebrae. They are midline and symmetric. And there is no deviation from side to side. His hips are, there we go. His hips are equal bilaterally. Go ahead and stand up for me. We will do some range of motion. Lean back. Good, and touch your toes. Good, and face the camera here. Swing side to side. Good, and rotate. Good, and he has good spinal range of motion. This concludes the exam.